Area prep, when you cut interdentally with this burr, remember it's concave. It will be shaped naturally away from the convex interdental areas of the adjacent teeth to minimize the chance of you hitting that. But also in that manner, remember, you're prepping the central incisor tooth, right? You're prepping it. So lean into it and open up the space, because the next burr you have to take will be bigger. And if you don't have enough space or feel confident, you will hit the other tooth, I promise you. And what you don't want to do is have to put so much force on the tooth that you're prepping. You must lean on the tooth that you're prepping, of course, but not huge amounts, okay? We're just doing space creation. Right, the next burr, just turn off the suction. Okay, the next burr we will use, okay, so we started with the 2 depth cutters. We then used that. Now we're going to, right, so for the posterior, we use the 010 and then the 012 to finish, right? Yeah. For ceramic, we need 1 mm clearance, don't we? So I'm going to not use these two. These are too small. Just stop drilling for a second. Thank you. We will use the 014 burr, okay? If I sink half the 014, what will I get? 0.7, which is close to 1. Yeah? So, I'm going to take this burr here. This is going to be doing most of the work now. So, what will happen here is turn the patient over, and we will do the facial reduction like I explained on the diagram. Lean this on the land area that is untouched at the correct angulation where the tip is in the gap, and just go across. Like that, and then you rub off the pencil line, like so. Come across, change the angle, the tip is in the gap and you're leaning on that part of untouched tooth until you rub off the pencil line. Now what you may get is this terrace here, this step. Don't worry about that, okay? We will go back and smooth that and blend that off. And now this last land area here, can you see the angle of the burr has to change a bit, yeah? But the issue I have now is if I'm trying to prep down here, the head of the handpiece is hitting and I can't reach. Can you see? Yeah. So what do we do? Bring it out. Exactly, we pull out the burr. So pull the burr out like that a bit. Make sure it's still engaged. And now look, I can reach that area, the head of the handpiece is clear. Can you see? Yeah? And again, like so. Now, these jagged bits I can just gently smooth. There. Okay? What I want to do now is translate the angle of the cervical up and over onto the singular wall now. Okay, now this is the most important part of the prep. I do not want to do this, watch. Lean on here, do this, and then move it like this or like that. Okay? So I don't want to come here and then do this or that. I want to take this wall here, the direction of which, because this will be opposed by the singular wall. There. Okay? Let me show you on the diagram. This is my burr lined up. Okay, we've already done this part here, there, and there. That's my burr. I want to take it up, 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 up over the tooth, and now create a near parallel wall on the cingulum. So that my cingulum wall, this cut here, is parallel or is near parallel to that. And it is this band of parallelism that is the most important part of your resistance form. Because your crown, with a functioning lower incisor like so, moving up and down in a protrusive movement, will want to rotate the crown that way off a fulcrum point here, there, in that direction. So if this wall and that wall are made parallel, the resistance against that rotation movement is maximized. Now, we are using an adhesive restoration that is glued on. So some would say, well, why bother? Because I'm using super glue and that will work. But let me tell you, your super glue at some point will fail. And it will fail when it is stressed in tension. Yes? So if your wall is very over tapered like that, the crown will always want to come off and it will want to put ripping motion onto that glue, onto your resin cement. And it will fail. I promise you it will fail. So we still must prepare with first principles in mind, mechanical retention resistance form, to help protect the adhesive cement so that you augment both mechanical retention and resistance and chemical adhesion for the restoration to never, ever, 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 ever come off, ever. Okay? Now, can we measure this? We can, and there are studies, but not chemical studies. Okay? So how do I do it prep-wise? The cut is not a big cut. It's a very small cut you make, okay? Because the cingulum wall area is very small. The cingulum wall is only this bit here. That bit, left and right, there. You're not going to go around the corner. Just cut. I want you to make that wall flat with that as the hard deck, okay? So it means I have to get myself in a position in which I'm most comfortable. I'm not really worried about the patient. If they're uncomfortable, well, they shouldn't be, but I have to be comfortable in order to make the maneuver. If I can't do it, then nothing happens. You may not be able to see this just because of the position of the camera, but in my head, maybe. So, you just tell me if my head's getting in the way, okay? Yeah, I'll make the cut and then I'll just show you. I can't position the camera because then the chin will be in the way of the phantom head. That's it. Right, have a look. Sorry, that's not me, that's the autofocus. Okay, that's better there. That's the cut there, okay? Now have a look. I'll pop the tooth out and let's see how good or bad I've done it. That's looking pretty okay. Can you see?
Yeah.
There. There.
Yeah.
You want that part to be parallel that part as best as possible. You don't want to over taper, otherwise you're putting too much stress on your cement. Yeah, does that make sense? Is it easier to see it like that? We get a dark background. Okay, you get the idea? Okay, so interdental cuts create space, facial reduction, apical wall, apical axial wall position, translate here, make the cut. Okay? Good. And when you're ready, you can do that.